So my name is Amanda Scott, and I'm going to be your host. I'll be introducing our speaker in just a moment. This is a webinar put on by Rooted Santa Barbara County and Savie Health. Rooted breaks down barriers to good health and advances health equity through joyful, community-centered food and nutrition education, lifestyle medicine training, and support, so every neighbor can eat to thrive. Savie Health provides free medical, behavioral health, dental, and vision care to uninsured adults in Santa Barbara County and beyond, regardless of race, gender, status, religion, or sexual orientation. Again, welcome to tonight's webinar. This is a healthcare webinar, and it's presented by Rooted Santa Barbara County and Savie Health. It's a nutrition, food skills, and education resource and does not provide medical advice. It is not intended to substitute for medical advice, guidance, or treatment. Please contact your healthcare provider for guidance on specific conditions, treatment, and lifestyle changes. I'm going to do a brief introduction to myself. My name is Amanda Scott. I'm a physician. I practice lifestyle medicine as a specialty, but I'm board certified as well in internal medicine. After 11 years in primary care, I left my practice to start my own practice called Santa Barbara Lifestyle Medicine. And I'm also a consultant for Rooted Santa Barbara County. I run physician luncheons each month in Santa Barbara here locally, as well as Zoom. And I host and organize these monthly webinars. You can join in on other Rooted events as well. You can discover a wide range of continuing education opportunities and complementary patient resources from Rooted Santa Barbara County and our partner, the American College of Lifestyle Medicine, at the following websites. So you can scan these QR codes to get more information on online learning, as well as information for healthcare providers. A brief introduction to lifestyle medicine, since most people are not familiar with it, is that it's a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular disease, type 2 diabetes, and obesity. The foundation of practicing lifestyle medicine is basically the 6 pillars of lifestyle medicine, which are nutrition, physical activity, stress management, restorative sleep, social connection, and avoidance of risky substances. So our presenter, Dr. Erin Presant, is going to get into each one of these pillars tonight in relation to brain health and cognitive function. So I'm going to introduce our presenter, Dr. Erin Presant. She's board certified in neurology, culinary medicine, and lifestyle medicine. She founded Central Coast Lifestyle Neurology Medical Group in Santa Barbara, where she incorporates lifestyle medicine into her care for her neurologic patients and promotes brain-healthy lifestyle changes for all of her patients at any age. She is a frequent speaker for nonprofit organizations nationwide and has been a keynote speaker addressing the intersection of lifestyle medicine and neurologic care, especially prevention of neurodegenerative diseases and improving quality of life for those already diagnosed with neurodegenerative disease. She's passionate about empowering patients with the tools to make sustainable changes for their long-term brain health. So I'm going to turn it over now to Dr. Presant so she can go ahead and start sharing her screen.
Thanks, Amanda. I'll start sharing my screen here. So let's see. Can you guys see my screen or no?
Yes.
Yes. Okay. Sorry, give me 1 second here. All right. Thank you for the introduction, Amanda. Yeah, so this is kind of a little bit of a unique topic in lifestyle medicine, not as talked about as some of the other ones. And so Amanda gave you a little bit of an introduction to lifestyle medicine, but I was also going to just briefly tell you a little bit about lifestyle medicine and then apply it to neurology. So as Amanda said, the lifestyle medicine includes therapeutic lifestyle interventions as a primary modality to treat chronic conditions. So when we think of chronic conditions, a lot of times we're talking about diabetes, cardiovascular disease, those types of things, as those are the most common. And these lifestyle interventions have been shown to be very, very effective in these diseases. However, there's a whole population of people in neurology who have these chronic diseases like Alzheimer's disease, Parkinson's disease, multiple sclerosis, Huntington's disease. And we don't necessarily think of them as these chronic diseases, but both Alzheimer's disease and Parkinson's disease are quite common in the United States and growing, unfortunately. So, it actually is a really great thing to bring that into the conversation about chronic conditions. So, lifestyle medicine is also evidence based, whole person, prescriptive lifestyle changes to treat and sometimes reverse these diseases. So, again, with diabetes and cardiovascular disease, there are great laboratory studies that can be done. And you can give your patient, you can say, well, here's your hemoglobin A1C and it's coming down and it looks so great. And in neurology, we are kind of lacking with some of these things that you can show to the patient that says like, hey, you're making a lot of progress. So I'll talk a little bit about that. These markers that we use in neurology, though, are usually quality of life related. They're patient reported and oftentimes based on a clinical exam that the physician does in the clinic. Um, Unfortunately, reversal of disease is not something right now that we see most of the time in neurology, as a lot of the damage that occurs in Alzheimer's disease or Parkinson's disease is irreversible. However, we're hoping that in the future we'll see some disease modifying treatments and using lifestyle interventions as well to help enhance those treatments. And there are not that many studies in neurology that show imaging or laboratory evidence of improvement, like I said. So, as I go through some of these studies, I tried to kind of pick out the ones that may have the best evidence, but, some of it we have to take with a grain of salt and we have to extrapolate some of the evidence. So really, in the absence of great diagnostic and prognostic biomarkers to identify early neurologic disease, so we can't tell somebody in their 40s you're going to get Alzheimer's disease, or even somebody in their 70s you're going to get Alzheimer's disease, or you're going to get Parkinson's disease. We don't have that yet, although again, a lot of research is going on looking for these biomarkers. And in terms of our therapeutics, a lot of what we do, the medications that we have to treat are basically treating symptoms. So, people start thinking, what else can I do? And lifestyle modifications are one place where we can turn where, there's very little downside, right? And that's amazing. That's great. If we can get some improvement, help people feel better, and there's little downside, that's really what we're looking for in medicine, right? So we want to use these lifestyle interventions to possibly prevent versus slow the progression of a disease. So if I have somebody with Parkinson's disease already, maybe these lifestyle interventions will slow the progression of their disease. Or improve their quality of life with those living with the chronic neurologic diseases. Most of what I'll be talking about has to do with Alzheimer's and Parkinson's, because those are kind of like the two biggest categories of what we call neurodegenerative disease. But there's also multiple sclerosis, where there have been some studies that show improvement in quality of life as well with lifestyle changes. And I think one of the most important and empowering things that I see in the clinic with people putting these lifestyle interventions into practice is a sense of control and over their own bodies and hope. Because for them to come into the clinic and say, well, here we're going to try these medications and just try to control your symptoms, a lot of times they feel like they don't have a lot of control, and it can feel very defeating over time. So in order to provide, to keep them going and provide a sense of optimism and hope over their condition, these interventions can really help. Also, if they start feeling better, that's a nice way to keep them doing these things. So I really think, one of the reasons I love lifestyle medicine is it is this multidimensional approach. So you can see that when we're talking about brain health, it's really, we can't really talk about it in a vacuum. I can't just say, like, you're doing this for your brain. If you're also taking care of your cardiovascular health and your mental health and your metabolic health, all of these things will play into neuroprotection or keeping your brain healthy too. So, and that's really, how I view lifestyle medicine is like it all comes together. Like our bodies, our brain is, it's kind of like the old song, right? Like your neck bone's connected to your whatever it was back then. But, like your brain's connected to the rest of your body and the rest of your body's connected to your brain. And so it all melds together. Okay. So, I won't be able to get through all 6 pillars because we can get so in depth and I had to like kind of stop myself, but I'm going to talk about the ones where I see maybe the biggest improvements in clinic in people and where some of the evidence is really the best. Um, so we're going to talk about physical activity here first. Um, if I think one point to make before I go into the studies is that also, if you're ever trying to talk to somebody about these lifestyle interventions, as I said before, there's very low risk in doing something like this, right? And I've never read, and if somebody has read a study that suggests that exercising more and eating better and sleeping better and not drinking as much alcohol and all of these things actually harm you, I would love to read that study, but I have never seen that. And so I think there's very little downside as we move forward. Keep that in mind. And I like to remind patients of this, that it really doesn't cost you anything, and it's really enhancing your overall health as well. All right. So as I said, in the absence of a disease modifying therapy, so a therapy that slows the progression or cures Alzheimer's disease or Parkinson's disease, physical activity has really been shown to have very promising results. A meta-analysis looking at 21 studies from all over the world showed that there is an association with those who met the WHO recommendation for physical activity and a lower risk of Alzheimer's disease. So the WHO recommendation for physical activity is very similar to our American Cardiac Association. It's 150 to 300 minutes of moderate aerobic activity per week for adults. And so there was this lower risk of Alzheimer's disease and an association with improvement in global cognition in people who already had Alzheimer's disease. So sometimes in some of these neurologic studies, we'll see that people who are more affected, when they make even little changes, we see bigger improvements, if that makes sense. So in these studies that were reviewed, there was a question about what is the actual dose response. So how much is needed, and does the association of how much they're doing actually lower the risk? And what are the actual characteristics of the exercise that are improved? And these are good questions because these are the questions you're going to get from people who are trying to implement these activities. So another study that came out actually just this year had quite a few participants, over 2,000 participants, aged 60 to 79. And all of them had a sedentary lifestyle, a suboptimal diet, and were at risk for cognitive decline. So they define that as having two of these things: either a family history of dementia, vascular disease, cardiovascular risk, race and ethnicity. At certain races and ethnicities are at higher risk, older age, and gender. So women are at a higher risk for Alzheimer's disease than men. So these groups were randomized to a structured lifestyle intervention group and a self-guided. So they were both coached to encourage their physical activity and take on healthier habits. But one group was very structured and had a certain amount of intensity and accountability. So the group that had the more structured physical activity had a statistically significant greater improvement on the global cognition compared with the unstructured group. So this is actually something that points to how important having a lifestyle medicine clinic, a lifestyle medicine physician follow along and encourage people to keep doing these things, or an accountability partner. Again, there were very low adverse events, and it can be helpful for your health overall. In Parkinson's disease, physical activity has been really one of the only things in recent years that we have seen that there has been suggestion of being possibly disease modifying. And there was a study that was published in 2024 that did a specific PET scan called a dopamine transporter scan on the brains of people with Parkinson's disease. So this was a very small study, but it was so encouraging that I'm sharing this with you. And we're hoping to see more studies like this. So it included 10 patients with mild and early Parkinson's disease. And they, at the beginning of the study, they had DAT scans done on their brains. Then they underwent a 6-month intense exercise program that they were followed along and made sure they were doing regular exercise of a certain intensity that was about moderate to vigorous exercise. And what they found were that they had an increase in these dopamine transporters in their brains post this exercise program. So that's what we're looking at here. This is a dopamine transporter scan. And what we're looking at is this area, that's the basal ganglia, where we see a lack of dopamine in people with Parkinson's disease. So this was the baseline at the beginning of the study, and post-exercise, we actually saw this increase in the dopamine transporters. There was also an increase in neuromelanin, which is a byproduct of dopamine breakdown. So the results really showed that the intense exercise program either kept people's dopamine levels and area of the brain that is affected by Parkinson's the same, whereas we would usually see progression, or there was slightly more dopamine. So this is really an exciting study, and one of the only ones that we have that shows like good imaging with results. So I'd love to see more of those, but again, it's promising. Now, what if somebody can't do this moderate to vigorous activity? Because that's oftentimes what we're dealing with. There's a lot of disability, or people may not have access to a place to do this, or they're afraid of falls, especially in the population with neurodegenerative disease. So a randomized controlled trial out of China in 2022 showed improvement in balance and motor symptoms with just Tai Chi. So the patients were evaluated yearly over 3 years, and the Tai Chi group had a reduced annual change in the deterioration of their motor symptoms. So the UPDRS is a motor symptom scale that we use in clinic to evaluate Parkinson's symptoms each time. And so they use that validated scale, and people did not have to go up on their medications as much. So this is also a great thing to recommend to people with Parkinson's disease, and probably Alzheimer's disease as well, and in general as we get older. But as you can see, again, the brain doesn't exist in a vacuum. The Tai Chi is also good for mental health, and may help to improve sleep and other things as well. So that's also exciting. But why? The question really is like, why does exercise help? And while we don't entirely know, we do know that there's this protection from protecting the brain from inflammation, as you saw in that study with the DAT scan. There may be this increase in the dopamine transporter availability post exercise. improved availability of these factors which help to clear toxins from the brain. And this bottom one, again, these are just factors that we see in the brain, but interestingly, we see reduced FNDC and 5 and irisin factors in the hippocampus in people already diagnosed with Alzheimer's. So physical activity may actually stimulate this other factor that helps to clear that, or to improve neuronal cell survival, learning, development, and memory. And may actually help to clear the beta amyloid accumulation. So these are some theories, and these are where the research is going. If we could kind of figure that out, then it would be very helpful in treatment and other ways that we might be able to get people to slow the progression of their disease. So what does this boil down to? You have somebody that comes into your clinic. What do you tell them? Well, I think that the most important thing is to encourage people to do something they'll actually do. So, I could give a prescriptive like you should be doing moderate activity, including speed walking, right? But if somebody's not going to speed walk, then it's not really helpful to encourage them to do that, right? So a lot of what I do is trying to figure out what they can do, what they will do, and helping them to encourage somebody who will do it with them. So, we getting an accountability partner, encouraging people to do that is really important. Sometimes that's needed for safety, but sometimes it's just really important to get you motivated. I mean, we all suffer from this lack of motivation. And when we have somebody with a neurodegenerative disease, there is a depression that can come along with that. And oftentimes it really manifests itself as apathy. So it can be hard sometimes to kind of get that motivation going. And studies have shown even just speaking out, just telling somebody your exercise plans, you're more likely to follow through on them. So I encourage people to get everybody involved. Establishing a routine is really important, and really acknowledging the little steps that people make. In the population that I see, people are oftentimes feeling a little bit defeated, as I said. And so really the encouragement is important, and the looking towards any progress is progress, really. People dealing with pain or other disabilities. I do think that there are ways to find something they like doing and to still move their bodies. Movement really is medicine, and when it comes to our brains, I think that the evidence really shows that it's one of the most important things that we can encourage. All right. I could talk a lot about that. Each one of these things I could give a whole hour on, but I'm going to try to keep it shorter. The plant-based nutrition. One of the questions is like, why would diet even matter to your brain? Obviously, like we think about cholesterol when it comes to your heart, and diabetes. Obviously, we have, glucose control and all of that, but it's not as obvious to a lot of people when it comes to your brain. So we know that a consistently poor diet, or the standard American diet that's high in ultra processed foods, can lead to an increase of inflammation throughout your body in a chronic inflammatory state. So, what else can affect that? Stress, poor sleep, depression. These all also contribute to a chronic inflammatory state. And I think all of us on here probably could check off stress, poor sleep, and or depression, right? And most of us probably don't have a neurodegenerative disease, but in Alzheimer's, dementia, cognitive decline, Parkinson's disease, these are very, very common. So we've got a number of things producing this chronic inflammatory state in their bodies. So the brain is very susceptible to this chronic inflammatory state. Neuroinflammation may actually trigger the development of amyloid deposits and neurofibrillary tangles, which are what the pathology of Alzheimer's disease. So that's what's actually in the brain. And in people with mild cognitive impairment, it's been shown that they may have an elevated serum IL-1B, which is an inflammatory factor. Some studies specifically in Parkinson's disease have shown that the gastrointestinal systems in the people with Parkinson's disease have an increase in the inflammatory factors. So this kind of brings me around to the gut, which is a big, I think it's big in probably all of medicine right now, but definitely in terms of the brain. So just to review the gut microbiota, there's about 100 trillion bacteria in our gut, and about a third that's the same among the population, and about 2/3 that's unique. No two people have exactly the same gut biome. So that is dependent on, your environment, what you eat, your genetics. So the closest they've found to having two people having the same gut biomes are really in tribes that live together and live off the land, like the Aborigines in Australia and Papua New Guinea. They have been shown to have very similar gut biomes between people, but the rest of us, we have all these different factors. So we know that a diverse and a balanced gut biome plays a role for overall health by helping to ward off harmful microorganisms, helping with immunity, and producing important substances for the body. There have been a lot of studies a couple studies, sorry, not a lot, a couple studies that suggest that there are differences in the gut biomes of people with Parkinson's versus people without Parkinson's. So just to make the distinction, I know Dr. Cass touched on this at the last webinar, if you were there. This doesn't mean that, these differences are what caused somebody to have Parkinson's, though. So, just because there's a correlation or an association, it doesn't mean causation. And so a lot of what we're talking about here, that's the case. And that's the case there as well. So the gut-brain axis has been getting a lot more attention. And so there's a two-way communication between the gut and the central nervous system. And again, this is becoming knowledge is playing a role in brain function, an important role in general brain function, as well as in neurodegenerative diseases. The abnormal proteins that are found in the brain in people with Parkinson's, known as Lewy bodies, are also found in their gut. So the majority of people, we see that in. So the question became, did these abnormal proteins start in the gut and make their way up to the brain, or vice versa, or is there some other mechanism that was involved? So there was a study that I believe came out of Denmark a number of years ago that suggested that maybe these proteins traveled up this vagus nerve. The vagus nerve is kind of the connection between the gut and the brain. And we're really trying to still figure out how exactly these two are communicating, but that was one of the theories. We do know what happens in the gut doesn't stay in the gut, and the gut biome has an impact on the central nervous system. All right, so what we put in there is important. So that brings us to our diet, right? Because that's what we're putting in there mainly, right? So I just want to clarify, the studies looking at diet and its relationship to neurodegenerative diseases are usually retrospective, done by patient reporting. And so sometimes these studies are a little bit inherently less reliable than large, like randomized controlled studies that we often, see for therapeutics. But, there's a lot of data out there, and some of them, the data is getting better. So I tried to share with you some of the most recent and like kind of how this has progressed. So again, correlation and association does not equal causation. There was an original mind diet study out of Rush University in 2015 that indicated that those that adhered more closely to the mind diet showed slowed cognitive decline with age. That was actually one of the first ones that suggested the mind diet. The mind diet is a combination of the Mediterranean diet and the DASH diet, which is for hypertension, low sodium for hypertension. Unfortunately, a follow-up study to the mind diet by the same group, the group at Rush, published in 2023, didn't replicate these findings. And there were actually no differences they found cognitively between the mind diet group and the group that didn't follow the mind diet. However, in the Rush Memory and Aging Project in 2023, they did do a post-mortem study of 581 adults. So these were autopsy studies, and they had been part of the project and had been filling out these validated food frequency questionnaires. And those that followed had the most intake of green leafy vegetables, had less global pathology in their brain associated with Alzheimer's disease compared to those with the lowest amount in green leafy vegetables. So green leafy vegetables are very important in the MIND diet. And so, overall better adherence to the MIND diet was associated with overall less beta amyloid burden. So that was the outcome of that. And also in Parkinson's disease, there have been some studies. The bigger ones have really looked at the Mediterranean diet and the MIND diet. There have been a few small studies, like with 10, 20 participants looking at the keto diet, that were somewhat interesting, but haven't seen that replicated yet. So the bigger ones really have been looking at the Mediterranean diet and the MIND diet. A review article from 2024 showed that adherence to healthy dietary patterns. So we're talking about a diet that is rich in fruits, vegetables, whole grains, and fish was consistently associated with a reduced Parkinson's risk. Whereas our Western style diet, the SAD diet, the ultra processed foods, and red meat were linked to an increased risk. So there's more and more evidence suggesting that the gut biome is really playing an important part in Parkinson's disease and Parkinson's disease symptoms. So it's important. The diet is an important piece of this. There has been a link to a high consumption of dairy, and mainly low-fat dairy rather than full-fat dairy, but and an increased risk of Parkinson's disease, and we see that more in men than women. But when we're trying to help somebody on a daily basis, I think one of the most exciting studies, somebody who already has Parkinson's, they have close adherence to the Mediterranean diet, but has been associated with improved motor and non-motor symptoms. So Parkinson's disease affects the whole body. Every system in the body is basically affected, and it really can affect their quality of life. So if we can improve any of those symptoms just by changing diet or improving some of the diet, dropping some ultra processed foods, incorporating more vegetables, whole grains, and fruits, then that is worth doing. This is the MIND diet. I just wanted to kind of show you. It's not as kind of broad as the Mediterranean diet. It really tells you what to limit. So you're limiting butter, you're limiting pastries and sweets, you're limiting red meat, and you're limiting whole fat, cheese, and fried foods. They even give you less than one time per week you're going to be eating that stuff. So it does include wine. I'm going to talk a little bit about alcohol, but this is from the original 2015 study, but really focuses on berries as the main fruit source and green leafy vegetables, as well as whole grains. It's not a vegan diet, but it really is very plant forward, and focuses on reducing all the other ultra processed. I always like this Mediterranean diet pyramid because it's so colorful and people look at it and I think it is enticing. And one of my favorite things about this pyramid is that the base of it is to be physically active and enjoy meals with others. So I think that is a way to incorporate, dietary changes as well as being physically active, as well as being socially connected, rather than just being like, you need to go on a diet and eat this at home. What we're really talking about is not a diet, right? So when I think of a diet, I think of these fad diets of the 80s and 90s, trying to lose 10 pounds to fit into a dress or whatever it was, this whole horrible yo-yo dieting mindset that we had been in. And really the MIND diet, the Mediterranean diet, I think of them as tools to help people establish a better eating pattern. So we really don't want to be doing that yo-yo dieting. It's really something that needs to be sustainable. So small changes are what I encourage. So if that means somebody can eat one more serving of leafy green vegetables per week, that's something, we're gonna start there. All right. If that means they don't walk down the chip aisle in the grocery store, that's something, if you don't want to eat it, don't bring it into your house, right? I think that's always an important thing. And so we really want to establish these eating habits and think about, okay, am I putting enough vegetables? Am I putting enough fruits? Am I putting enough legumes on my plate? Does it look colorful, or is it kind of all that beige, ultra processed color, or bright colors that aren't found in nature, like Takis or Red Hot Cheetos or whatever those are called. All right, so moving on. Oh wait, I thought. Sorry, did I skip? Okay, I thought I had a slide in there. Anyway, so what you can recommend to your patients is really trying to eat as much plant forward diet as possible, and doing something that's sustainable. So sometimes it really is about finding out what they like. Again, if I'm telling somebody you need to be eating a Mediterranean diet and they think that means it's falafel and yogurt, and they hate that food, then they're not going to do it. So it's really about understanding what they're going to do and what they are willing to do and what they can do. There are costs associated with that, which can be a hindrance for a lot of people. All right, so social connection. This is actually a really, really important one for our brains. Humans are social by nature. Even if you're an introvert, if you're an extrovert, if you love to go to parties, if you like to sit at home, your homebody, we're social. We're social people. We know that people who have stronger social connections tend to have overall better health with age. And in the blue zones, I think everyone's probably familiar with the blue zones now. A really important factor for these people in these societies are their social connections. And a lot of those societies that those people live in are set up to support social connections all the way through life. So, the population I tend to see in clinic is elderly, and we see that our society is not set up really well for our elderly people, and they lose their social connections. So the social connections are so important, possibly due to a reduction in stress levels. Depression was noted to be worse in people who are isolated, and social isolation affects sleep, mood, cognition, and your ability to manage stress. So again, all of these things are those, it's all connected. They're all this circle that one affects the other. A study from Johns Hopkins showed that in community dwelling adults age 65 and older, the 9-year risk of dementia increased with social isolation. So they define social isolation as living alone, or not having somebody that you could talk to about important matters. Actually, 2 or more people in the previous year. If somebody said, no, I don't have anybody that I talk to, then they were considered socially isolated. And not attending religious services or other social events. So it doesn't have to be religion, but just getting people out into social events is important. Of course, with the COVID-19 pandemic, a lot of people became more isolated, and those with chronic diseases, especially neurodegenerative diseases, became even more isolated. So there's a survey tool called the ProPD that was given to about 1,500 participants. And those that reported to be lonely reported a 55% greater symptom severity than those who did not report loneliness. And those who documented having a lot of friends reported 21% fewer symptoms than those who reported few or no friends. Now, I think that this is a really important study because people are reporting that they had greater symptom severity. They were reporting that they had that if they had more friends, they had less symptoms. And what's interesting about that is whether I see it in the clinic or not, how somebody feels affects their entire body and how they view their disease. It affects their progression of their disease. It affects what they're going to be able to do. So, we really need to encourage people to be social, to get out, because they will feel better. I spoke with a woman today who, I've been encouraging, like, you have to get out, you have to be social, you have to find somebody, one friend. And she just got back from a vacation with her sister and comes back and she's like, my Parkinson's disease is so much better. I'm feeling great. And, it really is about, it's not about what I saw in clinic, it's about how she was feeling. So this is really an important thing to remember in specifically neurologic disease, but in everybody too. As I said before, unfortunately, our society is not really set up to keep our elderly connected or engaged. Losing driving privileges, which I unfortunately do see a lot of, leads to more isolation and less social connections. A lot of people, when they start having a neurologic disease or problem, or start losing, having some mild cognitive impairment, they really don't want to talk to friends because they're embarrassed. And social isolation is linked to more sedentary behavior. Greater than 10 hours of sedentary behavior, oftentimes spent looking at a screen of some sort, is associated with an increased risk of dementia. So just to put that in perspective, though, we're not just talking about our elderly here. The average American spends 9.5 hours a day sedentary. So this is, a social isolation. Yes, well, we see it a lot in our elderly. Our society is becoming less and less social, and we need to be really encouraging people to be out because they are not as sedentary when they're out and being active with other people. Of course, this disrupts sleep and mood as well. So this is our multidimensional approach that I showed you earlier. As you can see, like the physical activity affects how somebody wants to eat, and their physical activity affects sleep, and physical activity may affect their mindfulness. Your mindfulness affects your diet, and your diet affects mindfulness, and your sleep affects physical activity. And all of these things are related to your overall health and how well your brain can be protected, um, and where it's going to go. I think restorative sleep is very, very important, and I think stress management is too, but I chose this avoidance of risky substances to talk about because alcohol is a big topic, right? Um, so alcohol in the brain. The studies on alcohol and its effect on the brain have been somewhat unclear and have provided contradictory evidence in the past. So most of these studies are observational. There are a lot of confounding factors. People stop drinking when they get diagnosed with a neurologic disease. So they're difficult to interpret sometimes. And for a long time, light to moderate drinking was thought to possibly provide this protective effect against cognitive decline, but more recent studies suggest that there's no safe amount of alcohol for the brain. So this is becoming the line in most areas of medicine: cardiovascular health, GI health, in oncology, I believe, that there's really no safe amount of alcohol. Um, the most one of the best and most recent studies that suggest um, a, a causal link between alcohol and all-cause dementia. So we're not just talking about Alzheimer's disease; it's really all-cause dementia, which includes other things like frontotemporal dementia, Lewy body dementia, things like that. Had Came out of the US and the UK. So I believe it was Oxford and Yale study, and they used genetic analysis. So they followed 500,000 people, 56 to 72 years at baseline, over 4 years for the US cohort and 12 years for the UK cohort. Over 14,000 participants developed with dementia. So initially they did an observational analysis, which suggested this U-shaped curve between alcohol and dementia risk, which is what we've seen in the past, U or J-shaped. So non-drinkers and drinkers had higher risks of dementia than the light drinkers. However, then they did this genetic analysis, which looked at 4 genes that are had high association with dementia. and it suggested a causal role of alcohol consumption in increase in dementia risk. So it was um, a linear relationship. So there was none of this U-shaped curve. It suggested that no amount of alcohol would decrease your dementia risk, and as the alcohol got higher, your dementia risk went up as well. So that was one of the newer studies that that showed that the brain really is susceptible to alcohol. I would say the evidence is less good than maybe in some of the other areas of medicine, but I think the recommendations are really going to be the same. Again, a overall healthy body is also a healthy brain. So if someone doesn't drink, don't tell them to start. There's no reason to start. If someone drinks heavily, they need to begin to minimize that. If someone's a light drinker, I really think discussing the risks and benefits and considering other health problems and medication use is really important, because how all of those things interact is important. And from a neurologic standpoint, in the patients that I see with neurodegenerative diseases, of course, gait becomes a problem, balance, alcohol can affect gait and balance, so it might not really be safe for them to be having alcohol from a fall standpoint. Of course, it can affect cognition. So if somebody's already having some cognitive problems, drinking on a short-term scale can affect cognition as well. And then it can affect sleep as well. So here are like the broad takeaways from what I've gone over. I think physical activity has the most and clearest evidence for maintaining cognitive health. It takes time to establish routines and incorporate movement. And I think even people with pain and disabilities can move, and modifications should be encouraged and are fine to do. I think just saying, oh, well, you can't do anything is not the approach, and maybe even defeating for that person as well. Minimizing ultra processed foods and increasing fresh plant-based foods. Telling everybody they have to be a vegan, I get like people shut down, right, if I tell them that. So I think making these slow changes is important, and they'll make their way towards those fresh vegetables and fresh foods if we keep encouraging them that way. Has to be sustainable, and it has to be made a way of life, right? Including the whole family or friends, improve social connections, which is one of those important things. From a cost standpoint, frozen fruits and vegetables can be cheaper and are more accessible and are perfectly fine. To use the nutrients are great in those and better than eating something that's more processed. Canned goods can be used as well. From a price standpoint, those might be better, but looking for low sodium and no added sugars is important from that standpoint. Of course, minimize or get rid of alcohol. And another question I do get is about CBD and THC, and we really don't have any good studies on long-term brain health for those for like people over 50. There have been some studies looking at teenagers and the progression into the young adulthood, but really from an elderly and neurodegenerative standpoint, we don't have any good studies yet. So a little bit of common sense. All right, so stress management and restorative sleep. I didn't specifically talk about these, but as you can see, like the restorative sleep comes along with so many of these other things that I think sometimes we forget to address. How are you moving? Are you moving during the day? Are you anxious because you're sitting in your house all day and you don't have social connections? And of course that all affects sleep. And then of course, stress management too. So these things are really important. I didn't not talk about them because I don't think they're important. It's just I kind of ran out of time and chose the ones where I see the most questions and hear about the most. Yeah, so that is my take on playing the long game for your brain. I call it that because, like I said, we don't have those markers that, somebody can come into clinic and I can say, oh, your blood pressure is down or your hemoglobin A1C has improved. I have to say, hey, you're still thinking really well. This is great. You got to keep doing these things. So it's kind of the long game, and you got to kind of just like stick in there and believe that this is really going to help, which I do. So.
Thank you, Erin. That was amazing. I really appreciate you presenting on brain health. I think it was really, really helpful. Some things that I am so impressed with is that the changes you can make for your brain also happen to be good for the rest of your body. So I think simplifying things, for patients and saying, as you said, this can also help with your cognition and your heart health, and all of your systems, and they're all interconnected. And I also really liked how you talked about slow changes and small steps and how important they are for making changes sustainable. So thank you so much for your presentation. Really impressive and just awesome. So thank you so much.